Today, we are talking about pain so intense it can stop you cold. A numbness so profound it steals your expression. We are talking about the invisible agony of trigeminal neuralgia, Bell's palsy, and chronic facial pain. These are conditions often misunderstood, misdiagnosed, and frustratingly resistant to conventional treatment. But what if the real problem isn't in your face at all? At the heart of these devastating issues often lies one critical player, the trigeminal nerve. Think of it as the undisputed control center for your face. It's responsible for two massive jobs. Number one, it powers the muscles of mastication, every single muscle you use to chew food. Without it, eating becomes a painful, if not impossible, task. Second, it gives you feeling in your entire face, this whole area here, your forehead, cheeks, jaw, and teeth. It's how you perceive hot, cold, rough, smooth. It's literally how you perceive the world through your face. When this nerve or closely related nerves like your facial nerve go haywire, the results are devastating. Let's break down the common conditions that arise when these crucial nerves are compromised. First, trigeminal neuralgia. This is often called the suicide disease because of the excruciating burning, stabbing, or electrical shock-like pain it delivers. It can feel like fire spreading or a sharp knife twisting in your face, jaw, or head. This isn't just a headache, it's agony. Bell's palsy, a sudden one-sided weakness or complete paralysis of the muscles of your face. Your eye might struggle to close, your mouth might droop, making simple acts like smiling, drinking, or even speaking clearly a nightmare. TMJ dysfunction. Beyond simple jaw pain, this can manifest as difficulty chewing, limited mouth opening, a jaw that shifts painfully, or constant discomfort around your ear and jaw. It impacts your ability to eat, to sleep, to talk, and to actually live comfortably. When you're dealing with these kinds of symptoms, it's easy to jump to conclusions, but we need a systematic approach. There are first critical steps to rule out common culprits. You must, number one, rule out a dental problem, an abscess, a hidden cavity, or even issues from a recent dental procedure can mimic trigeminal neuralgia. Your dentist must clear you first. Super, super important. Number two, rule out acute causes. Sometimes the sudden onset of something like Bell's palsy can be linked to an overwhelming stressful event or certain toxic exposures. Similarly, chronic stress can absolutely lead to severe TMJ dysfunction through teeth grinding and clenching. These are actually legitimate causes and they need to be addressed immediately. But what happens when you've checked all these boxes and still the pain, the numbness, the droop persist? What if your dental work is perfect, your stress is managed, and yet you are still suffering? This is where most people get stuck. This is where conventional medical paradigm often hits a wall. You've been to the dentist, you've seen some specialists, maybe you tried gabapentin, steroids, and even a mouth guard, maybe 2 mouth guards. These might offer temporary relief, but they rarely solve the underlying problem. Why? Because they are treating the symptoms at the end of the nerve, not the root of the issue. Here is the critical insight. The trigeminal nerve, along other crucial pathways for facial function, is intimately connected to and highly susceptible to irritation from the very top bones in your neck, especially your C1 and your C2 vertebrae. These two bones protect your brainstem, which is where many of these delicate nerve pathways originate or pass through. When there is a history of trauma, think a car wreck, a fall, or even repetitive toxic exposure or stress, it can compromise the normal biomechanics of your upper cervical spine. This subtle misalignment is interruption can create irritation or pressure on those delicate nerve pathways in that area. Think of it like a kink in a garden hose. The problem is not at the nozzle, it's at the kink. That irritation at C1 and C2 can cause the entire system, trigeminal nerve, facial nerve, TMJ function, to break down. The burning facial pain, the jaw issues, the facial paralysis, the headaches, the migraines, the vertigo, the brain fog, they can all be direct downstream effects of an upper cervical problem. So, when dental issues are ruled out, there's no obvious external cause. Your facial pain, your trigeminal neuralgia, your Bell's palsy, they can often be an upper cervical problem in disguise. The medical approach focuses on the pain, the symptom. My job is to tell you that when all those tests come back clear, you need to get your neck checked, because that's where the true solution often lies. Delivering long-term quality of health, not just temporary relief. In our next video, we'll dive deeper into exactly how the C1-C2 connection impacts your nerves and how your body is wired for healing when that interference is removed. I hope you have a great day and you learned something from this awesome opportunity to better understand the trigeminal nerve, the facial nerve, and a correlation to an underlying upper cervical problem.